there's only 1,100 pediatric endocrinologists across the country, and they're all overwhelmed as it is. And it's all the
Mhm.
same problem. It's a problem that Medicaid does not pay enough money for the children to be seen, and 50% of the children are on Medicaid. And if you're not in a procedural based science or career, and you don't have a heavy insured population, then you're treading water. And I think the endocrinologists, the peds, our friends in peds endocrinology have it worse because at least we get some easy stuff of the broncholytic or the ear infection, or once in a while the diaper rash, or the mom just thinks that this rash is really dangerous and it's hand, foot, and mouth disease, and it's a easy, quick, and it's going to get better. But the endocrinologist, there are no 10-minute visits for them. I don't know how you do a type 1 diabetic, look at their data, look at where their numbers are, counsel them, adjust their insulin in 10 minutes and move on.
Oh yeah,
So
you can't. 10 minutes and move on is not realistic.
no, but so what do? They're pressed. They have the same thing, but much more complex patients.
Mm.
So I find that to be very distressing because as I think most pediatricians were empaths, and we want to take care of our own. I was going to say a bad word, but we want to take care of our own house, and but not do any harm by giving the child the best person for that disease they have or they're living with. And it's hard when I see all these obese children or these kids with type 2 diabetes, and the teenage girls are struggling tremendously. And how do we take care of them?
It's a
Well,
struggle.
it's starting to become a general pediatric, like always, it's becoming a general pediatric issue to deal with. And I don't think I mean, we can learn about it. We manage ADHD, we manage, I personally don't like doing the anxiety, depression, but I'll refill a medication that was prescribed by somebody else. But I shouldn't be the one managing anxiety and depression. It's not my thing.
I do manage anxiety and depression because there's no one else to do it. So
Well,
I did a couple conferences from psychiatrists to learn, and I have some pretty decent boundaries. I will prescribe fluoxetine and sertraline, but I don't go into the atypical antipsychotics. I don't branch out into ones that we haven't. The conference I went to, one of them was really good about what we're going to do is a first step. You can do the first step while you're waiting for a referral. And if the first step works, then great, go with it. So I do think we need to be flexible and adjust to the needs of our patients. But if I didn't do it,
nobody
it would
would.
be catastrophic, guys. It would be catastrophic
Yeah,
for my
yeah.
community.
Yeah.
The problem there is the payment, and you know this well, George,
Yeah.
because there's two partners in your practice that do all of this chronic disease management, and these are complex, time-intensive patients, and the revenue is not there. Especially if you're a solo provider, there's not three other people seeing the easy stuff fast to compensate for the more complex stuff. It's a big hit, and the only solution is better payment. We need to pay the pediatricians and the family practitioners what we really deserve for doing the work that we're doing. And especially when you're a solo practitioner in a smaller town, that if that practice goes under, there is no backup. In
You
my
know,
neighborhood, there's lots of other pediatricians. If I stop seeing patients, there'll be a longer wait, but there's still someone to see them.
yeah.
In Bayshore in Long Island, if RBK closes tomorrow, Juan Spinoza will take some of the patients. Allied will take some of them. But in
Mhm.
these smaller communities, closes the door, no one's coming.
Yeah. I hear what you're saying with the more payment. I agree with that. There's always better. But I think the burden that physicians have with anxiety and obesity and all these chronic diseases is not so much. Could you get to work with a patient that has anxiety and do your job and prescribe whatever medication you need to do within 30 minutes if you didn't have to write anything?
No. And oh, George, man, I love that idea. I know I'm like, I want to
That's where
try
it's
so
at.
bad.
That's
When you
where
guys
it's
listen to
at.
this AI scribe, it's
Yeah.
terrifying.
Yep.
I
I've been
find it
using it for
terrifying.
a
I tried it
year.
one day and I was like, oh my gosh, it just
Yeah.
really fills in a lot of stuff that didn't.
I get to do checkups, right? You'll see a checkup. You have them fill out the PHQ-9, and I find one that's suicidal, happens all the time.
Mhm.
That is put a gun to my head, Dr. Bravo, when that happens. I got to spend another half hour and this and that and blah, blah, blah.